is Dr. Isabella. Welcome back to my channel. Today we are going to be answering all of your questions we got after the procedure of the dark circles 2 weeks ago. My name is Dr. Isabella. I'm your personal cosmetic doctor and your friend and guide in the field of cosmetic medicine. If you're new here, welcome to my channel. If you're back, welcome back. 2 weeks ago, we did a procedure of dark circles under Rico's eyes and we got so much questions. Thank you guys. We really love you. Love that you're engaging in our community so much and we want to help you. And today we are going to be answering a few of the most popular questions we got regarding the dark circles. What is the most asked question? A lot of you guys are really interested, how long does the effect last? So this is a question I get almost with any procedure. With every video I'm kind of repeating, it is very important to know the brand. So every filler, every brand has fillers that last, a couple of months. Some last 6 to 9 months, a year, and Juvederm, Restylane sometimes can stay up to 1.5 years. The duration of the effect is correlated with the thickness of the filler, and that's again depends on the brand. For example, Trough has made a filler that is especially designed to be used with the dark circles and the tear trough, which is called Redensity. Now I have used that filler in procedures under the eye and it is really a good choice. I always assess the problem, then I estimate the amount needed, and also I always take into account the wishes and the financial possibilities of my clients, and then I come to a conclusion and an offer for some brands and some possibilities of fillers. I won't be saying you need to use this one or that one. A couple of brands do have filler designed specifically for the tear trough. Also, I get a lot of questions. Is the procedure painful? Well, that's also one of the things I repeat a lot. Pain is really an individual matter. Now, we really have some procedures we see as really quite painful, like doing your lips or lines above your lips are considered by the majority of our clients as really, really painful. The thing is, with this part under the eye, the dark circles, these are really not that painful. There are a lot of pain sensors, there are a lot of blood vessels. The amount of pain is quite sustainable. The only thing that people do comment about during the procedure is they kind of feel crack when we use the needle on periostally, which means on the bone. Now in this procedure, so with the tear trough, there are 2 methods of doing the procedure, which is personally my favorite, and I only use that procedure. I even do this very procedure to myself in my own bathroom when I stand in front of the mirror, and then I inject myself. Yes, you guys, I know, all of you guys who come to me, you know the story where I faint. Yes, I do faint. But I really make sure I keep the needle away from everything. So when I faint very elegantly. You have the needle technique and you have the cannula technique. Now, what happens with the cannula technique? The doctors, my colleagues who prefer the cannula technique, they use quite a long kind of a needle, but it's not really a needle because the opening is different. So first they use a sharp needle to make a little opening, usually somewhere in the middle of your cheek, and then they go with this long cannula. They go through the skin, they seek out the bone, and then when they are at the point they wish to treat, they just retreat the needle and place a few drops of filler on the site. So the reason some colleagues use this technique is because theoretically it should be less painful and it should result in less bruising. My own opinion is that I can do more precise work when using a needle. If I see that some areas need more or less or are higher, lower, whatever, I can be more precise and I can do the procedure more precise when using a needle. So that's why I prefer the needle. The only downside, and I really have to confess, like from the deepest parts of my heart, I really have to confess, it does give more bruising. So you can really, go home with looking like a raccoon. And of course, one of the major questions again is about the financial part of everything. So how much does a procedure with filler, how much does the treating of the dark circles and the tear trough with fillers cost? This particular procedure is quite time-consuming, really very important, very precise procedure. So we really want to do the best job we can. And we do that with the rest of your face, of course, no doubt about that. But this particular area, there are a lot of blood vessels, there are a lot of pain sensors, there are a lot of structures. So we really take our time to do this procedure. Depending again on your age and on the form of the dark circles, some people just have a dark circle and they have volume loss. Other people kind of are able to pull out the skin, so like this. That's a whole other procedure. And mind you guys, usually when there is too much skin, there is a big question whether the procedure with a filler is the most effective, or perhaps you should go to the plastic surgeon or another specialist who can do this procedure by surgery. But if you are a candidate for the fillers, we assess at that moment how much filler you need. Mind you, like 2 years ago, I had this beautiful male model, this guy, a really sweetheart. He did a lot of photo shoots, but he was like 19 or 20. He really had very pronounced tear troughs and dark circles. I can remember we did 1 whole milliliter on one side, 1 whole milliliter on the other, and he even came back after 2 weeks to do a touch-up, which again we did half here and half here. So this means we did 1.5 milliliter in this side and 1.5 milliliter on that side. I'm not sure which brand we used because it was in another clinic. I think it was Princess, the new Cypher, but I'm not sure the volume. But on the other hand, like a few days ago, I had this lovely lady. She was in her mid-40s, and we just used 1 milliliter. We used half and half, and we got a beautiful result. So this is really what I'm trying to say. It's very difficult for me to tell you exactly how much you need, but if you're a girl and you're quite young, there's a big chance you just need half, and when the age is a bit higher, or sometimes with male patients, we need a little bit more. Then we got one question which was really, it's a really good question. I'm really happy you're asking it. Can I go blind? If you do research on the internet, you can see a few horror stories, which are going blind, having huge infections, having some part of your face die off. Now, usually these are really horror stories or have happened in really questionable circumstances with injectors which we really do not know about their qualification. I will not lie, in this part of your face, your nose and this part of your face with your eye, there are a lot of blood vessels in connection with the rest of your face and your eye. In this particular area here, in this particular area here. As you can see on the picture, there is a little like a hole here and here, and we have blood vessels, nerves, and a very important structures coming from there. An injector, whoever he or she might be, does not know what she or he is doing and is doing the procedure very, very wrong. Yes, there could be a chance they do horrible things and things go wrong. Mind you, I would not do this procedure by myself, to myself, in my bathroom, in front of my mirror, if I was every time taking the chance to make myself go blind. So yes, there is a possibility in this area, but no, you guys, if you choose a qualified doctor with experience, no, you don't have to be afraid. So you guys, these were the most important questions we got. I hope I've answered them to your satisfaction. So if you have any more questions, leave them down in the comment and I will get back to you.